I'm Dr. Tom Meade from Allentown, Pennsylvania, target of the Billy Joel song. So I'm here to talk to you about the most important system in our body you have never heard of, the endocannabinoid system. I want you to listen closely because this may be the most important talk you hear today that could immediately impact your practice when you return. It'll improve your outcomes, your patient satisfaction, chronic pain in your patients, neuropathic pain, sciatic pain, preoperative anxiety, postoperative sleep disruption, arthritic inflammation with virtually no side effects. Oh my God, why did I not know about this awesome product? Because it wasn't discovered until the mid-1990s, when many of us have finished medical school. Even if you're in medical school today, only one of 4 medical schools will even mention the endocannabinoid system. There's no prescriptions. The government put up roadblocks for 100 years as far as investment and research. That all went away in 2018 with the Farm Act, when the handcuffs were taken off and we could invest in it, and hemp was made legal in 50 states. Big Pharma smelled profits. There's over 200 R&D studies out there now to patent drugs, including the first one on the market, Epidiolex, for childhood seizures. So that's it. The talk is over. Go down to the vape store, pick up some CBD, give it to your patients, and you're in business. But wait, it's a non-regulated industry. You have no clue what's out there. It's contaminated. It's not third-party tested. Most important, you don't know how much THC is in it. Bad for doctors, nurses, healthcare workers, pilots, professional athletes, and elderly patients. None of them want the side effects of THC. You want something that is physician recommended. When we're in the office, every patient in every exam room you walk into is there because of pain. All pain, as we heard today, comes from inflammatory mediators at the neural junction. We're all there treating problems with bones, tendons, ligaments, ingrowth, muscles, infections, 90% of which come from our own microbiome. It's all controlled by the endocannabinoid system, and it helps anxiety and sleep. What does the endocannabinoid system do? It's a supercomputer in our body that controls homeostasis in every physiologic organ and process that we have. If we just look at the musculoskeletal system, through its receptors CB1 and CB2, it controls the same list of symptoms that our patients come to the office to be treated. So it's only common sense. This is a perfect fit for orthopedic treatment and CBD products. This could be a Spielberg amazing story. Why is it called the endocannabinoid system? Why do we have an internal cannabis, an internal marijuana system that controls every physiologic process in our body, and we don't know about it? It's been around for 600 million years. It's an ancient neuroregulatory system. It's essential for health. It's dysregulated in every disease process, and it's the receptors in every organ. It goes back thousands of years. Just because we didn't know the mechanism of injury, the mechanism of action, it was used in Chinese and Indian medicine for pain, nausea, and epilepsy for years. We used it for 100 years, up until the 30s, when the government put the kibosh on it with the Marijuana Act, and they scheduled this as a Schedule I drug, which again then went away in 2018. We didn't even know the active ingredient, THC, until the 60s. It took another 25 years to figure out how it worked. It attached to a receptor in the brain, and we figured out God didn't put that there to get us high, so there must be internal chemicals called cannabinoids, named after cannabis, that these attach to. They found a second receptor responsible for inflammation in the periphery and a second chemical. The whole puzzle came together. So now we have it. We have these important receptors in our body. CB1 that controls pain, sleep, and anxiety. CB2, infection, inflammation in the periphery. We have endocannabinoids that attach to these receptors, and phytocannabinoids that we can give patients that can help them. I was using this for 10 years. I thought I was the only orthopedic surgeon in the country until 2 years ago. I walked through the academy, found this company that had 50 of the largest orthopedic companies in the country using it. Why were they using it? Because it was founded by pharmaceutical executives. It was THC free. It was only accessible through healthcare workers. It had the highest standards from the FDA, and it's third-party tested multiple times. There are now tens of thousands of articles showing that it decreases pain, but the real evidence is patients' evidence with their wallet. $17 billion every year equals over-the-counter non-steroidals for anxiety, pain, and sleep disruption. But you say, is this safe? Look what we're using with non-steroidals, Tylenol, and opioids. It's terrible. CBD, the net effect is zero. There's no LD50, and there's virtually no side effects. So what are we really treating? Musculoskeletal system or the endocannabinoid system. We're treating both. So I implore you, for the surgeon, to harness the endocannabinoid system. You'll have better patient satisfaction and outcomes. It's a lot of information. I put a handout in your packet if you want to learn more about it. And if we ran out, I think it's at the Corganics booth. Thank you.